everyone. Good evening. Thank you for making time to be here. This is our second round of Synergy initiative. You may recall that we started this to understand what the folks who are not developing retirement communities are doing and to integrate the rest of the members into better understanding of each other's business. So towards the same, we have a few members presenting here today. So Bani, if you could just kind of explain who will be going first, second, and third. Let's get the session going. Thank you, everyone, again.
Great. So would like to welcome everyone to Synergy session, Synergy Initiative Session 2. And we have International Star Assistance, Pharmallama. So we have these three companies joining us today. And I would just request everyone to please mention your organization names also. We have support elders also joined in. So I would just request everyone to please mention your organization names, because we'll be doing a quick polling after the presenter, after the person has presented their presentation, so that we can connect people better. And I would just request everyone to please keep themselves on mute, and we will have the question answer session today after all the three presentations are done. So I would request Mr. Sanjay Jain from International Star Assistance to please start with his presentation.
Thank you, Bani, and thanks for keeping me at the front. Let me justify the time and the opportunity given. Hi, good afternoon. This is Sanjay Jain. I'm the director here for International Star Assistance Private Limited. We are a medical assistance company operating headquartered at Delhi, and we do have India offices. So I'll take you through a quick presentation, which is going to be very simple and crisp. Just give me a second. Okay. I hope people are able to see my screen now. And so, can you see the screens now? Yes, great. So, friends, as I said, we are International Star Assistants, and who we are, I'll share with you now. Who we are. We are ICP group, and we do have many interests, including the encircled area, which is of interest here for the people and for the forum here. We handle the death, air evacuations, medical assistance, medical repatriations, and bit of health insurance. The things which are relevant for this forum. Of course, we do have more services, but we'll not talk about those. Me and my life and business partner, Poonam Jain, both have been coming from prior to being in this venture, we have been into jobs. Poonam worked for US diplomatic mission for good 20 plus years. And out of those, almost 16 years was for the mission critical citizen services. She is the most recognized and rewarded employee had been the most rewarded employee of US government outside US. And she has global experience of handling medical emergencies and all difficult situations, whether it is legal, medical, or anything, especially for the expats. My interests have been, of course, on the wealth management, renewable energy, and other things. Here in this organization, I'm essentially onto networking, marketing, and administrative services. That's what my role is. Poonam has been the most awarded and rewarded. Our company is the most rewarded and awarded company in the world for such kind of services, which includes medical evacuation, and we'll talk in detail later. To an extent of Indian government recognizing it, PhD recognizing it, and there is a whole plethora of awards and rewards. Some from Canada, US, New Zealand, Niti Aayog, Carter Women Entrepreneur, Niti Aayog, ENY. So we have been doing what we have been doing, and those are getting recognized because these are bit of, I'll not say unique services, but uniquely aggregated services. What are those? We'll talk about it. Our foundation is, we have formal partnerships. That's how we operate with global insurance companies. We are, of course, members of such forums where we do get business or some kind of business insights. I personally happen to be a member of FICCI, National Task Force on Health Insurance, improvising the health insurance products and services And there have been a lot of discussions in the ASLI forums about senior living, senior citizens health insurance. So there is a topic which is getting discussed in this national task force. I'm part of it. And there are other things which we can discuss later. We do have our formal offices in New Delhi, Mumbai, Bangalore, Dharamshala, happens to be a visitors town, Chennai, and of course other cities in the world. What we do, essentially, this is what will be of interest to all of you. Here it is. Please take your time to read through it. One, as I said, we are the aggregated service providers. And when we say aggregated, we are serving the medical or travel insurance companies worldwide. We are their India partners. We work for high commissions and embassies. We are working for the multinational companies. They do also engage us. We are closely in coordination with the air transportation system, including the commercial airlines and the air charters. When it comes to medical devices, equipments, and service providers, they are our aggregated partners. Medical institutions, of course, all the hospitals and such tertiary care centers. What we arrange for the client. We are arranging for road ambulance or air ambulance, essentially transfers, road ambulance or air transfers. And out of this also, 95% of our revenues are from the air ambulance side, not the road ambulance side. The road is there just for the reasons. Of course, we provide doctor escort on commercial airlines, death handling, that means cremation, burial, repatriation, telemedicine, home isolation. So you can see that this is a complete bouquet of medical emergency handling and some of the post-care elements. Okay. So this is what our forte is, combined services, one-stop shop. We started essentially for expats and foreign nationals who are traveling into India or who happen to be at Indian subcontinent for ABC reasons, and they'll end up into any such situation where they need medical assistance. So that's what our key target segment. Recently, we expanded these services to the Indian masses, and now we are trying to carve out a specialized version for senior citizens. COVID, suggested us that we should be serving this special segment. So we are just carving it. We are yet to design it properly, and ASLI helps us. Association with ASLI helps us understand the requirements and the models. So this is what we are, and that is where we are. Now, why would someone prefer a company like us? There are many who are providing few of these services what we discuss just now. So one is, of course, we are 24/7, which every medical assistance company would go by. We are into comprehensive handling, right from primary, secondary, tertiary, transfer, insurance, embassy, documentation, death, government agency. So everything happens through one agency. So it's kind of a seamless and effortless for the family or the affected person. Second is we are able to arrange the Medicare, home care, healthcare devices. This is post-COVID. We were not doing it pre-COVID. Post-COVID, we have started arranging these as well. Our expertise lies into handling, especially when an individual is more or less helpless or is all by himself or herself, doesn't have a relative or kin to really take care of their personal as well as emotional as well as health requirements. This is where we come into picture, and that is our forte. I'll say like that. Really a forte that we have been handling since the expats who are arriving into India. Most of the time they will be found alone and stuck somewhere, and handling a whole lot of affairs around them. That is our specialty. So for senior citizens, this is a much desired service. That means there is no one per se for them coming from their relatives or friends. So this is what we do. What we can be doing further along with ASLI or members of this forum. See, since we are organized and globally awarded and already operating globally, it gives an assurance to the families who are living in the senior living facilities, and even to their children who are in 50-60% cases out of India, and they do worry about the quality and the services and the credibility of the agency who is going to provide the services. So our global presence and accreditations helps us stand out when it comes to services. So ASLI members, if they are aligned to us or we are aligned to them, it gives an added star saying that, okay, the services are available and provided by an accreditable, reliable, credible, experienced global agency. So that's where the benefit is. Since ours is an international network, so there is an assurance and we can be talking cross-country as well, or arrange help cross-country, which we do. I have hundreds of examples, what we do, how do we do. I'm not going to take time here now, we will take it offline. Since we have seamless tie-ups with the medical and travel insurance, hospitals and transportation, it becomes far more easier for a senior living home or an operator or a, whatever you call it, to rely on us saying that, Yellow Baba, you take it and carry it forward here onwards, including, God forbid, someone dies alone, being only person and dies in a senior living facility. So we can take care of it right from that deathbed to whatever is required, even the ashes going out to London to their children or whatever you can talk about. So we do all this. So that gives, frees up a lot of bandwidth. This is what I was talking, that ISAPL relieves the resources and responsibility of the senior living home promoters and managers. These all exigencies can be well managed by us being a partner. And important part is, recently, rather quite late, MOA had given the guidelines of there should be an arrangement with the nearest hospital for tertiary care. There has to be certain this and that. There are certain guidelines which have been published by MOA. If we are the partners of your facility, by default that gets tick marked, because we do have formal tie-ups with all major hospital chains of India. So you don't have to arrange for an hospital to hospital arrangements, cashless arrangement, admission, this, that. It is taken care as long as you have a written contract with us saying that, okay, ISAPL will be arranging and is the partner for us for all these services. And behind us, we have got whole plethora of these hospitals, tertiary care, air evacuations, death handling, everything. So your organization looks slightly more comprehensively designed and operative. Then there is something called, when it comes to Europe, there is now upcoming compliance regulation on personal data confidentiality, right? PDP, and in Europe there is already one which is prevalent, which is GDPR, and we happen to be compliant to that. We are working with UN as well in India for SDG 5. Okay, that's a sustainable development goals. So that's what we are also working. So we are globally exposed and aware of what are the upcoming requirements when it comes to compliances or certain government policies related to medical evacuations and assistance, now specific to senior living as well. That's what we are learning. So this is what we can do, and how we can move forward is very simple. We get into a simplistic non-legal type of an MOU, more of a memorandum of understanding rather than getting into an agreement or a cost-based this or that. And that's an agreement saying that we will be the preferred service provider or the only service provider. And that is when we do a local setup or realign our services, redesign our services bouquet for that organization. And that communication goes to, in this case, the senior living goes to the senior. So that communication goes to the seniors living in the facility. And that's where we start. We'll provide a toll-free number or a 24/7 number. And we get going. All the costs associated are charged on a case-to-case basis on actuals plus service charges. Okay. We are evolving this model yet at the evolution stage. Hence, we don't have commercials of any kind ready. We have been signed up by one of the leading senior living company in India recently, just last week. We are yet to make formal announcement of that. And the company has got facilities in 4 cities and they are just going to go 3 or 4-fold over the next 2 years. So we have been made their, they have trusted us to be their singular partner for all these services. A small addition, since we also have a sister company which is into all kinds of insurances, including life and health. So for the senior, this is becoming a completeness of the basket, because then providing them or serving on their health insurance or life insurance also becomes part of our services. So it becomes further a single stop shop. That's it.
Great, thanks a lot, sir. Request Divya to please do, share the quick poll. Sir, Mr. Jain would request you to please stop sharing your screen.
Yep.
We will do a quick poll. Request all the members to please mention your organization name so that the polling results will have all your organization names. So presenter will find it easier to directly connect with you. Divya, can I request? Yeah. So we have this poll, which is, for International Star Assistants. If anyone would needs to connect, you understand the business and want to collaborate, or you do not require the services yourself, but you can connect someone who would be interested in something like this. So request everyone to please take a poll, depending on which option you would choose, and we will get in touch with you after the session. I think we can have this poll ready for 30 more seconds, Divya, and after that, we can stop the polling. I would also request Mr. Tarun from Pharmallama, who's going to be going next. Hello, Tarun, can you please put on your video, and also hope you're ready with your presentation?
Yes, hi Bani. Hello everyone.
Great.
I am visible.
Yeah, we are just giving 10-15 more seconds for the poll.
Yes.
And please, we'll just request, in case you would want to do a quick screen share just to know that, your controls are working. Would request everyone to please do participate in this poll. The way I think we can take this down now. We can stop the poll. We can end the poll. I would request Mr. Tarun from Pharmallama to please start with his presentation. And we would be taking all the question and answers after all the 3 presenters have made their presentations. Tarun, over to you, please.
Perfect. Thank you, Bani, for introducing me. I'll just give a brief introduction. My name is Tarun. I handle business development for this company named Pharmallama. As you can see, it was, by the way, it was recently I got a chance to meet a lot of our ASLI members at Primus Reflection. So thank you, Adarsh, for that as well. Yes, moving on. Pharmallama, I'll just be very brief about what Pharmallama is about. The idea was to increase medical adherence in senior living, and especially for chronic illness patients, because medical adherence is something that has been a problem in India for a very long time now. Patients, they go and consult with a doctor for a particular chronic illness or any kind of disease, and once the medicine starts, it becomes a habit for patient to either forget their medicines, not they take their medicines on time, or also a lot of times it is a bigger challenge in the sense that since chronic illness patients take a lot of medicines in a day, for them to manage these medicines and make sure that they're taking the right medicines at the right time, and also not forgetting that medicines, becomes a big issue. So the problem was medical adherence was not there, and the solution was that we had to come up with a way where we can help out chronic illness patient to manage their medicines as efficiently as possible, with not just reminders, but also making a product where they don't have to worry about sitting down and segregating their medicines and always looking at their prescriptions. And hence this Pharmallama came up. Basically, you can call us a one-dose packing company. We obviously we are an online pharmacy as well, but what we do differently than your PharmEasy or MedPlus or other companies who are in the similar industry is that we pack medicines into sachets like this, as you can see, where all the details of the patients will be written on the sachet, whether the name of the patient. I'll just go through this slide. Yes, as you can see this, our personalized sachets have all the time and date consumption, plus the name of the patient, the medication name, dosage, and quality. So this small real estate will have all the details that a patient will normally need to look in their prescription to manage their medication. Now, this has completely, there has been multiple researches done on one dose packing. I can go to that slide just 1 second. Yes. So, this research has been done for a very long time now. As you can see, there was a research where there were 3 different groups of people, and the first group were given medicines normally, the second group were given medicines in one dose packing without supervision, and the third group was given one dose packing with proper supervision and proper reminders. Now, the first group saw a medical adherence of around 50%. The second group saw the medical adherence increase from 50% to 88% around, just through one dose packing but without supervision. And there has been above 95%, you can say, medical adherence from medicines in the group C. Now, this is a very big factor, and the numbers speak for itself that the medical adherence increases altogether, especially in chronic illness cases for patients who are taking medicines in this one dose form factor. So, we came up with this solution, and we have been working in Bangalore, and recently we have shifted to outside of Bangalore. In fact, we are now supplying pan India. Our concept has been to increase the adherence and help patients track their adherence. Also, we have our 70 to 75% of our team is just pharmacists. So any patient that reaches out to us, they get expert advice in how to manage their medication through these pharmacists itself. And yeah, so that's basically mostly about what we as a Pharmallama do. Coming back to what we have achieved over the last 1.5 years. Yes, we started in the month of April, from I think last year in the month of April. So it's almost been 1 year, 3 to 4 months now. As you can see, we have delivered these many sachets and capsules and tablets to chronic illness patients, and especially old age patients, because we have around 15 to 20 old age homes whom we supply regularly the medicines now in this form factor. And we have seen heavy increase in their medical adherence and the retention in how these people are, basically, especially the senior living people who are who are not able to manage their own medications, and they are dependent on like these old age homes or senior living communities to help them manage their medications. Now, just another number. Yes, I think since Praveen is already also there in the group, Rotary Orchids has been one of our oldest clients, and this is just a small number to show the kind of retention we have had with Rotary Orchids. And this is just one of the numbers. We have had similar retention rates with other not only senior living facilities but old age homes as well in Bangalore. And right now, since we are supplying pan India, so we are looking forward to having similar relationships with senior living communities and old age homes across and outside of Karnataka and Bangalore as well. I think that's it. The basic value that we supply for all of our consumers is personalized pre-sorted medications. Yes, our motto has been from day one to increase and improve adherence in consuming medications, and especially for senior living people. And yes, this is obviously a very easy and convenient process, especially for senior living communities. We have seen the process is much easier for them because they will not have to be dependent on their nurses or staff members to make sure that their residents or the senior living people who are in their communities are taking medicines at the right time. I'm sorry, Bani, are you talking about something? Okay, sure. So yes, so as I was telling, yeah, this is much more convenient for senior living communities because it helps out remove that manual, you can say the manual errors that could happen during any of their staffs like serving medicines to any of their residents. and obviously there is no cost involved in this because we don't charge anything for the packaging. We only charge for the medicine. So, and even on medicines, we do give your everyday normal normal discounts, which we are competing with even pharmacy and MedPlus now with heavier discounts as well. So that's majorly our value that we add to the consumer, and not only to the consumer but the senior living community that we are in partner with, and also the old age homes as well. So that's majorly about the few testimonials. This is again Praveen from Priyashya Healthcare now. Praveen has been part of our team. He's been our customer for a long time now, and I hope, in fact, we have got a very good feedback from his side and all the old age homes that we have been supplying. Um, to sum it up, we would love to expand. As I mentioned, we are expanding pan India now, and we have been supplying to individual customers pan India. So similarly, we would like to partner with senior living communities who are which are there in Delhi, Pune, and other places in India. And we would love to make your life easier as well in helping you out in managing your residents' medications, and also your staff's job easier as well. That's it. Please do reach out to me and any questions and queries you guys have, you can as is the protocol,
Yeah,
we will connect later.
Great. Thanks a lot, Tarun. Questions have already started to come in, but I would just request Colonel to please give us some time for the next presentation from support elders, and then we will have the question answer rounds together for all the presenters. Thanks a lot, Tarun. That was a beautiful, short and concise presentation. Now, I request, if you could please stop sharing your screen, Tarun.
Yes.
And if I could request Divya to please do a quick poll. Divya, if you can hear me, please. Yeah. So we have the poll with us. Request everyone to please do participate so that, we can reach out to Pharmallama in a much better manner. And is Mr. Apratham with us?
Yes, Vani.
Yeah. So request you to please switch on your video.
Yes.
And also, in case you would like to quickly do your screen share just to check, if all the controls are working. I think another 15 to 20 more seconds for the polling. And after that, we'll take off the poll and we will start off with your presentation. And after Mr. Apratham's presentation, then, the floor is going to be open for all the questions to all the three presenters in one go. So request everyone to please either use the chat box or raise your hand for better coordination of all the question answer round. Request everyone to please participate in this poll for Pharmallama. I think that Divya, we are good with this poll, so we will end the poll now.
Is it visible, Pani?
Yes, sir, it is. So I would request Mr. Apratham from Support Elders to start off with his presentation, and then we will take up all the questions together for all the three presenting companies today.
Yes.
So over to you.
Thank you, Vani. So I tried to stick to your advice of 5 slides and 10 minutes. So I'll try to keep it brief. So Support Elders. We started off in 2014. Our core objective, the way why we started, is to help the elders a better quality of life, enjoy their quality of life. And so this is something which we, one of our members talk about. His son actually talks about. Support Elders gives me a peace of mind. So largely what we do is, we, as I said, we're in the business of improving the quality of life of the elderly in society. The core services, we are kind of a partner to the elders. So, it's more like, wherever they are across the, cities that we serve, they stay at their own homes. We also serve a few senior living facilities. And apart from, so our medical emergency alert solution is only for our members, because with them we partner, we help them, with their out of home support, with some more things around remote health monitoring. We have a lot of IoT and sensor-based tracking, and I'll get back to those. And we work with ex-servicemen quite a lot. We are almost, as the graph shows, about 80% of our workforce are ex-servicemen, and the reason why we have that is that we, as I said, is a 24/7 operation, and also we have been dealing with different kinds of medical emergencies. Now, of course, when we are talking about medical emergencies of elders, we are not only talking of the extreme tertiary case, we are also talking of a fall. We are also talking of when they're completely alone at their own homes, even a bout of breathlessness, or those are things that we need to address. So we do have a kind of a watch which the members wear. It has various functionalities, but it also has an alert button. It connects with our alarm center, which is available 24/7. We have a multi-city alarm center, and we also, as I said, I was talking about remote monitoring. Very simple things. Like if there is somebody has a tendency to fall, there's a mobility related issues, we can do simple things like put in a motion sensor and a light which is which interacts with the motion sensor. So whenever he or she gets up on the bed, it kind of, the light is on, so that there is at least the visual referencing is there, so that falls are minimized. There are other things as well which we do, and we work with a lot of technology providers, aggregate. So as our logo says, we are integrated care. So we integrate a lot of partners, their solutions, their technology. Enriching cognitive solutions is our mental and emotional fitness part. We do a significant number of activities on that front, and both online and offline. And of course, independent living, one of the very important factors for the elders, because that's something where they are alone, or or the couple is staying alone in their own house. These things become very, very important. Very quickly, what we have done, we have served more than 11 lakh 50,000 care days. So those are days of care we have delivered. We have done more than 100,000 home visits for out of home assistance, managed more than almost 4,000 medical emergencies and exigencies. And of course, we, on the things that we talked about, 1,500 plus events. This is the cognitive part. Where our members have participated, more than 77,000 participants. This has happened over the last many years. So just to give you a quick sense, we do have a video, and I've sent it with the one page that Vani had requested. But these are some of the very quick things that we have done. In the first one we talk about is where this is a place which is slightly away from Kolkata. There was a medical emergency we needed to evacuate. So that happened. But after that, a couple of days, unfortunately, she expired. So, his wife actually talks about how we, kind of supported through that. Not only the physical support, but also the emotional support during those times, because they had actually nobody. Then there is this COVID situation. Of course, all of us are aware. But for elders who are staying at their own homes during this period, it was actually quite difficult. So the way we kind of supported it then. Then we had a case, and this is from Hyderabad actually, where it was quite again a life-saving kind of a situation which happened. And this is from, then we have, this is the first one is again a case of dementia, bedridden dementia patient. How he needed some, again, medical related factors. So there are others as well, which we have a lot of them. just wanted to give you a sense of what we do. It's not that it's not the only one. If you go to our website supportelders.com, you can actually see many more of this. What we do, we have been a lot of this thing in the press. We have been covered quite extensively the last 8 years, and so as far as our this thing is a partnership with ASLI is concerned, as I mentioned some time back, we are very keen to partner with technology providers, service providers, because we strongly believe that elder care is something which cannot be delivered by one organization, and hence we have reached out and we have partnered with a lot of other players as well, and we would want to continue to do that to help to kind of give the best propositions to our members. We also, this model is very light, asset light. We have developed this a very technology-backed model, though the technology at the front end is pretty simple. It is just a press of a button or some monitors who are not, which are not interfering with the daily lives. But the back end, there's very advanced technologies that we have developed, and now we are looking at other cities and other places that we can go to. But of course, we have a model which is where we talk of partnering with them. When elders join us, almost 95% of them continue for their lives with us. And hence, it's a very integrated technology members, our staff, primarily ex-servicemen. All of these are, we work together, to help the elders, kind of improve their quality of life. I will be happy to answer any questions that you may have, and we will definitely, take this discussion forward. Thank you.
Thank you, sir. Request Divya to please do a quick polling, and then we will open the floor for all the questions and to all our presenters. Just one second. So we have the poll for support elders also. Request everyone to please participate in this poll. And after the poll, I can of course see Colonel's question for Pharmallama. In case there are any other questions that anyone would like to ask, in case you can use the chat box. It's going to be preferred so that we can moderate the session well. Or otherwise, please do raise your hand, and I will definitely come to you. Wait another 10 seconds, and I think then we can end the poll, Divya. Thank you, everyone. Colonel, if I can request you to please ask your question now.
Yeah. Tarun, thank you very much for your very short and sweet presentation. And I think what you're doing is something very, very useful to people like me, especially when we don't know the difference between medicine A or medicine B, and we don't know when to take and what to read. Not only the phosphate that you showed, but definitely many of us are carrying multiple prescriptions, and we don't even know which prescription we should take when. I mean, that is because of age, we forget that. So just tell me, your service is free, or it is based on certain amount of money that I have to pay? And secondly, one of the things which is the most difficult thing today is to protect your confidentiality or protect your information that you leave behind in this digital world. So how is it that my prescription with you is safe? And where is it loaded? And you say that you get the medicines and then you pack them yourself. Can you just explain that? Because I'm a bit concerned on these two things. Like I know that 1 mg, if I order, I get the medicine. It is, it comes in a packed box. And of course, I have to then put it in the Monday, Tuesday, Wednesday, morning, evening, night. But you are packing the medicines and you're sending it, and then what is it that I have to pay, and how do I maintain my confidentiality of my prescription that you don't give it to anybody else?
Perfect. Thank you, sir. First of all, I would like to thank you for giving us Pharmallama the chance to be part of ASLI, because we got introduced to ASLI through you. And also, thank you so much for guiding us as well in the initial phase. Thank you so much for that. And it's the questions that you've asked I mean, exactly the questions that any of the our old age homes or any senior living communities that we connect with normally do ask. First of all, I'll go point wise. The first question that you asked was, do we charge anything for our service? No, absolutely not. There is zero charges for our service. I can show you the Pharmallama box. So this is a live order. This is a live order that goes up for any patient. As you can see, there is a sachet coming out of this. So this is the way the sachet rolls are packed into this. One by one, let's say like morning, then afternoon, then evening. Once a patient starts consuming one sachet, then the next sachet will come out, and the next sachet, and the next sachet, like that. So it's pretty simple. No extra brain to be involved in this. And also, this whole packing actually normally, yes, it does cost us something, but we don't charge anything for that to the patient. All the patient has to give us or pay us is like what your 1mg pharmacy does. Even the deliveries right now is free. So all the patient has to give us is the medicine cost. So let's say if a medicine in the market, if you go and purchase from a local pharmacy for 10 rupees, we will also ask you to give us just 10 rupees. If the local pharmacy is giving you 10% discount on that, we will also give you 10% discount on that. So basically you will be paying us 9 rupees like your local pharmacy. There is no other charge.
Can I ask one more question?
Yes, sir. Please go ahead.
I remember the days that when you guys started from somewhere in Ranchi, if I'm not wrong.
Mm-hmm.
I was a bit intrigued as how this Ranchi or what this lovely idea.
Mm-hmm.
But notwithstanding that, I see the product has come out.
Mm-hmm.
There are 2 points which I want to ask you. The medicines, you are getting it locally or somewhere, and you are packing it in this beautiful packet that you are sending it to us.
Mm-hmm.
So where does this packing take place? Because it takes place in one of your central area, and from where you send it?
Yes, sir. So to answer that question to you, we have a complete GMT facility with humid temperature and all these kind of moderated temperature. Even in fact, the humidity of the facility is maintained using sensors. So I'll give you a background, sir. I think when I had this initial conversation with you, I mentioned to you that we are backed by Associated Capsules Group, which is India's, or I would say Asia's largest medicine packaging company. If you take up any 10 strips of medicines nowadays, whether it is Cipla, Dr. Reddy, or anything, 7 out of those strips will be packed guaranteed by ACG. So they have the expertise involved in packing and packing for medicines for manufacturers from A to Z that is available in the market right now. All kind of manufacturers get their medicines packed either using a machine from ACG or ACG's facilities. So we have got that expertise through them, and we have created a similar small scale module of a GMT facility here in Bangalore. We would love to have you come down as well sometime, sir, if you're here in Bangalore again. This facility, only pharmacists are allowed inside this facility. Not even the founders are allowed to go inside, and the whole operation of packing these medicines is done by a machine. There is no manual work involved in that. From the moment the medicine goes inside the machine till the medicine comes out in this sachet form, and then it goes through a visual recognition QC check machine, and after that only we do a manual check and then send it across and pack it and send it across to our customers. So the whole process is automated. There is no manual work involved. Basically, there is no touching of medicines by hand involved in this. After the medicine is put inside the machine. So that is why we maintain this whole process, because we don't want to contaminate or tamper with the medicines that have been taken out of their original packet and then put into this new packet. And also, because we got the expertise from ACG, we know every kind of medicine combination or any kind of medicine to medicine interaction that can happen inside a packing or a sachet. So we know all the different kind of combinations, and accordingly we do this whole packing. There is no chances of any medicine getting tampered inside the sachet, and moreover above the sachet there is an extra added layer. So as you can see, sir, this sachet is actually 90% biodegradable. So the normal strips that you use, those are all non-biodegradable strips, those are all plastic strips, but this sachet is 90% biodegradable. Only the outer coating and the printing which happens is non-biodegradable, which we are again working on that also to increase the biodegradability of this product, to maintain a pollution-free environment as well, because we have seen specifically in the medical industry that all of this medicine strip waste, it goes into landfill, and that is becoming a very big issue as well. And obviously people are not looking into it right now, because a lot of this, yes, it gets recycled, but a lot of it doesn't get recycled, and because of that slowly this is accumulating and becoming a big issue for landfill as well. And so hence we had thought that if we also do the same non-biodegradable sachet packing, it will not make sense for us. So we did that research, 3-4 months of research went into this. I think I had talked about this to you initially in the initial days, but yes, on that sachet also again there is an outer coating which is again an in-house coating, or you can say an in-house development from our side, that protects the whole sachet from any kind of outside tampering or any bacteria or virus or any fungus or something getting inside to the sachet. So it is a wholesome product, as similar to what strip you get from your pharmacy or 1 mg. So obviously they have researched it in strip form, we have researched it in sachet form. That's it.
Very nice to hear all these details that you are giving.
Mm-hmm.
And I will touch base with you separately.
Sure, sir, absolutely.
It's wonderful to hear that something which is not available, and to many of us, even from a pharmacy, you are able to give us free of cost and at our doorstep. It's remarkable, and I wish you all the best in all your endeavors.
Thank
your
you.
partner, forgetting his name, I met him in Bangalore.
Arjun, sir. Arjun and Kaushal, yes.
Yes. Wish you all the best.
Thank you so much, sir. Thank you so much.
Would request everyone, in case there are any questions to the presenters, please feel free to ask the questions.
Yeah, Tarun, just a quick question. What is the lead time for this delivery?
You're asking whom?
Tarun, you are on mute. Please unmute yourself.
Okay. I'm so sorry about that. Yes, thank you, Apratam, for this question. Yes, the TAT time. I think you're asking about the TAT time, right?
Yeah.
Yes. So from the order confirmation, also I would like to mention that we don't take any orders without prescriptions. We are a proper prescription-based pharmacy, so we do not take any orders without prescriptions. All our prescriptions, once we receive that, so any order is called confirmed once we have a prescription on in our app, or in either through WhatsApp or whichever channel somebody communicates with us. And once that is there, the TAT normally in Karnataka is 3 days. Outside of Karnataka, yes, the only constraint, because we have our base only in Bangalore, and this, as Colonel Achal sir asked, that we do this packing right now only in Bangalore, not in anywhere. We will be slowly expanding to 4 other cities in the next 6 months. But right now, the TAT for other states, or I can say cities in outside of Bangalore or Karnataka, is 7 days.
Okay, thank you.
Maybe you should tie up Tarun with the senior living and care guys who are in this group to give you space free of cost, and that can enhance your business faster.
Absolutely, sir. Absolutely. We'd love to do that. Thank you for your idea, sir.
Any other questions?
Of course, I must compliment Apratim as an ex-serviceman. He is supporting so many ex-servicemen. I know where to go to if I want a job. But it's an excellent thought that whatever they are doing, they're dependent so much on ex-servicemen. That shows your trust in this breed of people. I hope it will continue after 4 years or 5 years from now.
Sir, actually, thank you so much, Kanasa. In fact, what we have done is that we have actually created a kind of a career map for them. So, there's like, for example, the people who had joined us 7-8 years back, those NCOs and ORs, they are today the operating leaders within the organization. So, they have grown with us, and that is why we have been able to retain. So, in fact, just to update you, we are talking of actually creating a DGR course on elder care, so that we can have a more trained kind of thing. So that's something that we are discussing, and if that works out, that will be even more helpful. Because I have seen these over the last 8 years, kind of impact the ex-servicemen and they can make in delivering this kind of care. And as you rightly said, it has been a lovely journey. Thank you.
Definitely, I only hope the Army headquarters knows that you exist.
Yes, sir, we work directly with the Indian Army, actually. In fact,
with the DG resettlement.
Yeah, with the DGR, we do.
Perhaps the training centers.
Not so much the training centers, sir. We work with the DGR and we also work with the APNs, Army Placement Notes.
Good, very nice to hear. So come to Calcutta, I'll meet you.
Sure, sir. Love to do that.
Would anyone else like to ask any questions to, support elders or to International Star Assistance also? Tarun, if I could quickly ask a question to you, how does one register with you? I mean, in case, are you only looking at group bookings and, through doctors or through communities, or can someone just log on to your website, share their prescription and, you'd be willing to...
So, Bunny, thanks for the question. Yes, we obviously partner with old age communities or senior living communities. For them, the mode is completely different. For them, they can order in bulk for multiple patients altogether. But for individual customers or people who are not living in senior living communities, yes, for them also we have a mode where we have a up and running app ready. It is named Pharmallama itself. You can download our app through App Store. It is available both on Android and iOS. So you can download it, and all you have to do is just register yourself as a user, put your name, if you are ordering for yourself, you can put your age and your name. If you are ordering for your family member or somebody else, you can put their details, create a user ID, upload a prescription either through by clicking with your camera, or if you have a soft copy of that, and that's it. And then your job is done over there. Our pharmacists will reach out to you after that, and then they will confirm your order. They'll check with you regarding all the medicines, the frequency. In fact, the timing that is mentioned in the sachets, like 9 a.m. in the morning, 2 p.m. in the afternoon, all that also can be designed and regulated according to you. So if, let's say, somebody in your family takes medicines in the morning at 8 a.m. and others take at 9 a.m. So we can put different timings in the sachet according to you, depending on what your requirement is. So all that will be checked by our pharmacist on the call once you have uploaded the prescription, and then we'll confirm your order, and then the order after if you're in Bangalore, within 3 days, outside within 7 days, you'll receive the medicines. And for refill orders, we ourselves will reach out to you 7 or 10 days prior to your medicine getting finished. So let's say we have sent across a 30-day medicine roll to you. So after 20 days of your medicine being sent, we'll reach out to you for refill, and then you can confirm to us whether it is the same medicines you're taking or if anything has been changed in that. And then we'll again send it across to you before your 30-day roll gets over, and then you'll have for your next 30 days.
Great, thank you.
Yeah, sure.
Would request everyone to please let us know in case there are any questions that you would like to ask, or otherwise we will call it a day.
Thank you.
Great. I think, we can definitely reach the presenters offline also. So thanks a lot to all the presenting companies and to all our lovely members who spare their time and joined us for this session. We'll meet you next month.
Thank you, Bunny.
Thank you, Bani. Thank you, others.
everyone.
Thank you, everybody.
Thank you, everyone.
Thanks a lot.
Thank you.
Really.